What's up, Nurse Gang? Welcome back to another video. This your girl, Nurse Shar, currently at LPN. I've been doing that for a couple years now, for those who don't know. Right now, I'm also in the LPN's RN Bridge program at the time of shooting this video, okay? So as you can see from the title of the video, we're going to talk about what's in my nurse bag. Now, what's in my nurse bag might be different from what's in yours, okay? I might nurse different than what you nurse, so I might need something different than what you need, but this is what I need as a nurse, okay? All right, let's get to it. So, let me grab my bag, hold on. All right, so my nurse bag is here. Everybody have like a little cute nurse bag with their name on it, customized, say nurse, nurse, nurse. Listen, I went to Coach. I got this on sale. This is a very affordable bag. It's heavy duty. It carries, so you saw how, look, it carry a lot, okay? It carries a lot. All right, so this is my nurse bag that I use. It's also a backpack because I'm in school, okay? Look, we'll use a 2-for-1, a 2-for-1. Have different compartments, of course, for different things. It's a backpack. It's a backpack, okay? Let me tell you what's in it. That's what matters, what's in it. Don't talk about me, y'all. Don't talk about me. What's in it is what matters, okay? Let's get to it. All right, so the first thing is, of course, stethoscope. You cannot nurse without a stethoscope, okay? I have actually 2 different ones. This is the one I use like every day because I do night shift nursing. So unless there's like a huge change of condition, things like that, I don't really need like my big fancy one or whatever. But this is still a Littman. It has 1 bell. It has my name on there, y'all. You can go with Amazon to get something personalized. I think I actually got this one from eBay. Got my little name on there, so that's cute. My little stethoscope. So you gotta always have a stethoscope. I have this Littman, and then I also have this Littman as well with the double bell on there. So we have the smaller one, larger one. You're gonna use your stethoscope to do a number of nursing duties, such as like assessments, evaluations, auscultate the lungs, listen to lung sounds, auscultate the heart as well. You can do apical pulses with it. I'm a little old, so I do manual blood pressures. So I use my stethoscope to do my manual blood pressures as well. I'm not too fond of the other blood pressure, but we'll talk about that. We'll talk about it. This is a stethoscope. This is what I use. It blows my mind, guys. Like when I'm at work and I see nurses like literally walking around with the the little yellow, y'all know what's about, the yellow disposable stethoscopes. And they're good for what they're good for. You know, typically we use those stethoscopes when it comes to people who are on isolation and precautions, things like that. It's disposable. Use it, boom, boom, boom. Do what you need to do, then throw it away. But I see people walking around with the disposable stethoscopes. You cannot do that. And they're not as good as quality as having your own stethoscope. So that's the first thing that's in my bag. All right, next thing. Let's see here. It's my, don't judge me, y'all. Don't judge me. Your girl got a fanny pack, okay? Look, the words coming off because I've been using this from day one, okay? I am not one of those nurses that wear scrubs every single day. I'm not. It's just not for me. I'm kind of big, as y'all know. And I get a little hot. I cannot do scrubs every day. So I do my nurse shirts that I make. Shar Creates LLC. So shar.creates.llc. If you on Instagram, Facebook, whatever, you go in there and see what I do. You ain't gotta order nothing. Just see what I do, okay? Because right now I can't take orders. I'm in school, y'all. I ain't got time. All right, anywho, fanny pack. So this is my little fanny pack. Just disconnected here. Connected here. All right, you put it on. Look, got compartments for everything. I have so many compartments. I don't even use all of these compartments, guys, but I use this mainly this first row. As you can see, I got my different Sharpie pens that I use. Very affordable, good pens. my wound care scissors. I have different size wound care scissors, but these are just the ones that I keep in my fanny pack because they're for like little everyday little cuts that you need to do. And don't ask me what kind of cuts you got to do every day, okay? Just listen to it. Trust me, y'all. This one. I also have my, I'm trying to pull it up, y'all. My Sharpies, highlighters, different color pens. What's this called, y'all? I forgot what it's called. Stylus, little stylus pen that you use. I got that as well. So that's what I have in my fanny pack. It has a couple of compartments on it. This is my friend. We went to nursing school together, and he actually passed away a year after we became nurses. One of the most positive, one of the most inspirational people I know. So I carry him with me every day because he always tell me, girl, you're going to be a good nurse. And that's what keep me motivated. That's what keep me positive. So I keep him with me every day. All right. So then I have this compartment that you can just unzip here. Now you can use this for anything that you need kind of locked up a little bit. So I keep my little lip glosses, my little lip chapping here, ponytail holders, because this is cute and all, but when you're doing some real nursing, you got to throw this stuff back, okay? Throw it in a ponytail. Don't tell me, y'all, I don't be stealing, but look. I got lenses in here, because you know, if you go into a patient room and you check their blood sugar to say if you don't milk it enough or they don't have good circulation, anything can happen where you have to do more than one poke. So sometimes I keep a little extra ones just in my fanny pack just in case. Just in case, okay? I don't use it for personal use, okay? Don't get a girl fired. All right, so that is that. So many different compartments. So I have my fanny pack in there. I also have, this is my bag in a bag. So, ooh, heavy. All right. Hold on now. All right, I have my handy dandy bag in a bag. I know it look like a lot, y'all, but it's not. It just look like that. So this is my bag I use. I work every shift in nursing, every shift, but right now I am a night shift. Anytime I work days or PMs, this is a bag that I use in instead of pretty much like my fanny pack, because night shift we don't hand out to me medication, so I can use my fanny pack, go boom boom boom, versus where I'm actually moving a med cart from this side to that side of the unit. So I have this on my med cart. So this is where I store my highlighters. You need every color. Why? Because that's just what I do. Okay. Oh, I got my other scissors, y'all. I'm looking for these. All right. Then I have my Sharpies, my markers, other color pens. Look, pen light. Pen light, pen light. Make sure you always have a pen light. I don't know what kind of nursing other people do, but when you're in a hospital, you need a pen light. When you do your assessments, when you are in long-term care rehab, or wherever you are where they are, where there's like a fall or something, you have to do your neuro checks. You have to have a pen light, okay? You have to have one. Look, don't be using the flashlights on y'all cell phones to do y'all neuro checks. Stop it. Don't do it. Get a pen light. It's cheap. It's cheap. It's cheap, okay? Let's put that back right there. All right. And so then also, where is my, oh, here we go. My other wound care scissors. So I actually got these from Amazon, guys, and it came in a 3-pack. They are so cute to me. I know it's not supposed to be about that, but they cute to me. A 3-pack. So I have like these itty bitty ones. I have my everyday ones, and then I have like, I gotta cut through some curlix wound care scissors. So they came in a 3-pack from Amazon. I don't remember the price, but clearly it had to be affordable if I bought it, okay? Because I'm cheap. I'm cheap. I'm cheap, okay? So go on Amazon, buy you a little 3-pack, and you'll have different, you know, different sizes for different things. Also, make sure you bleach them down after every use with a bleach wipe, okay? That's why I'm okay with touching them right now, all right? So you definitely got to have your wound care scissors. That's, I keep my big ones in this bag. All right, in my bag in the back, I also have my thermometer. 98.0. The block is hot. Your girl is hot. This is very handy dandy. This is one of my old faithfuls, okay? I bought this like 2019. Put them little 2 batteries in the bottom. Call it a day. It's been working for years, okay? Got that from Amazon too. What else do I have here? I have my hand sanitizer that I keep in my bag. In between, when you can't wash your hands after every single patient, you definitely have to at least sanitize your hand after every patient, and then after every 2 to 3 sanitizing, you go wash them, okay? But I always keep some because I just feel like when it comes to these facilities, I did agency CNA and agency nursing for so long, and I feel like you can't put those things into the hands of the facility. I've been to places where you like, they should have this, they should have that. But if they don't, you need to have it for yourself. So I've been to facilities where it's like either they don't have hand sanitizer or you go through 3 different hand sanitizing stations before you find one that actually got hand sanitizer. I don't feel like playing that. My health, their health, everybody's health is important. So I bring my own hand sanitizer. Also, after you wash your hands, you got to keep your hands hydrated and moisturized. So I got my little lotion here that I keep in there. Probably need to throw some on right now. Don't look. Don't look. Why you look? Why you look? You're supposed to look. Y'all be doing me wrong. All right. Another thing that is in my bag. My bag in the bag is my blood pressure cuff. Remember earlier I was telling you that of course, use your stethoscope to do a number of things. One of the things that you do, of course, is measure blood pressures. I am not one of those people that uses the wrist blood pressure cuff. I'm not the one that use like the little desktop blood pressure machine. Nothing is wrong with it, but just personally for me, I like to do manual blood pressures. Reason being is, of course, they say that it is the most accurate. And I just don't want to hurt anybody. So I want to make sure that it's the most accurate blood pressure when I'm administering these medications. So I do the manual blood pressures. Also with the machines, I've seen where like I'll say, okay, put it above your heart, with the wrist ones, and all it takes is one. All of a sudden you throw the whole blood pressure off, and have to start over, or you throw it off and it's an inaccurate reading. So I just like to use my manual blood pressure cuff. My mom, I don't know where she got it from, but she bought it from me while I was in nursing school, and it's been like 5 years now, and she still works beautifully. I love it. I love it, love it, love it. Of course, you can still disinfect it in between. I even use bleach wipes, and it haven't caused any discoloration or anything. I use the bleach wipes in between when I use on different patients. I know some people say, well, you have Dynamaps, you have this, you have that. Honestly, I've been in healthcare so long. I've done agency nursing for so long. You don't know how many facilities that I have been to that did not have vital supplies. At the end of the day, you are the nurse. It is your job to make sure that you are being a safe nurse. So I'd rather bring my baby, stay stocked up, stay prepared, rather than just pulling up somewhere and just being like, well, I can't take the blood pressure because you don't have blood pressure machine. All right. Anywho, so that is my bag in the bag. There's a few other things in here. I don't know. Another thing I do have is, of course, my clipboard. Now, this clipboard, believe it or not, like this was popping. When I was in nursing school, this clipboard was popping. Now, I don't see it as much, but it was popping when I was in nursing school. And it was very helpful. As you can see, it goes over like normal ranges for like vitals and weights and things like that. When I was doing nursing, in the doctor's office, we did EKGs. So this was very helpful for when I did EKGs, it's like a little cheat sheet down there. And then also like a little pain scale. On this side, we have like lab values, things like that. We have our ABGs. We have our gauges for needles when you're doing injections as well. Insertion sites when you're doing injection. And down here, it's kind of the same thing that we had on that pen needle. I mean, a pen light. And we had on a pen light, just looking at the different sizes of the pupils when it dilates. So this was popping. Like when I was in nursing school, if you didn't have this, you wasn't nobody. No, I'm just playing. I got this actually from the Goodwill. Y'all, look, everybody was up there paying like, no lie, like 30 some, 40 some dollars for this clipboard. It just so happened. I just always have favor. Thank you, higher power. I went into a Goodwill and found it, and it was in better condition than what it is now. It's raggedy now because I've been doing my thing for a while now. This was a little raggedy, but I found it at a Goodwill, and it was like $5. So this is my clipboard. Now, this clipboard can fold. You know, people put it in their pockets, whatever. Can't fit in my pocket. My pocket not that big, but some people, you know. But I don't fold mine because I use mine a lot. As you can see, I have these, let me cover up some of these numbers on here. As you can see, I have like a little clear sleeve, and I put some sheets in here. And this is just a regular clipboard, but I just kind of spruce mine up a little bit. I like to make sure whatever I use, I get full usage of it. Take full advantage of it. So this little clipboard, y'all, look. Hold on, let me take out this paper. Hold on, because I don't want to violate any HIPAA or anything. Let me take these papers out. All right. So this is just a regular clipboard, okay? That's all it is, just a regular clipboard. I got me some, tape. And I taped a clear sleeve to it so I can have like a little open close thingy. Look, I know that's a little ratchet, y'all, but let me tell you, let me explain. Linda. Let me explain. So the reason why I did that is because when you do long-term care or facility nursing, whatever you want to call it, and you are passing medication, you're going from room to room, whether it's with your clipboard or whether it's with the medication card. And then, of course, when you pass the medications, you're going to have your clipboard with you as well. Now, when I go into a resident room, I may or may not need to bring my clipboard. So what I do, I got my little cover page. So whatever like roster information or whatever is going to be on my clipboard, this closes and separates it. So it won't be like any HIPAA violations or anything like that. So it's really helpful for that. And then also, like I said, I did like agency nursing and things like that. So I have like my little passcode. Look, y'all, it's so raggedy, but look, it does what it needs to do. Okay, I'm not one, but I do agency nursing. So I have like my little password, my passcodes for different facilities that I go to. Instead of saving it to my phone, you know, I just have everything right here. Now what's on this sheet is a couple of things. So here I got my name. That's my number. I don't care. Y'all can call me. I be bored at night. No, I'm just kidding. My name, my number. And I just have it just because sometimes I take a break, and if they need me while I'm on break, hit me up. I'm not one of those nurses that won't, you know, come off my break, because I don't never really have a real break. My break just be sitting in the corner somewhere. So that's why I have my number here. Anywho, also at the top, as you can see, I have important numbers. So for that, I have the medical director information. I have the pharmacy information, the lab, the x-ray. So I have those like quick numbers on my clipboard, because sometimes you'll be down the hall and you need to call the doctor, you need to call the lab, and you're not at the nurse's station. So I just like to have it like a quick reference to it. Also here I have wound documentation. So you will see just the different documentation, cheat codes, and things that you can use for wound documentation, like if the skin is intact, how the drainage look, the color of it, how the incision look, things like that, because some facilities require you to document every wound that you change. Even though you have an order to change, they want to document the progress of the wound. So I have that. I also have, what did it say right there? I can't see y'all. Oh, types types of wounds. So I have like little cheat sheet notes on that, how I can document that. Also Foley documentation, what the urine looks like and things like that, how I can document that. I am one of those nurses that, of course, it's the CNA's responsibility to like empty the Foleys and things like that. But I'm one of those nurses where I like to empty my own Foleys, mainly because I like to see the real output. Could that be nice sometimes? Also because, okay, all jokes aside, I like to see what the urine looks like. I know that sounds weird, but one of the biggest things in these facilities are UTIs. And then, of course, if you have Foley, people can have frequent UTIs. So I like to look at the urine to see the color of it, the smell of it. Not saying like I'm like, but look, we need to know if it's a foul odor, things like that. You know, any hematuria. I just like to look at that for myself. That's just kind of nurse I am. So that's why I have the Foley documentation on here. So last thing I have is my laptop in my bag. Okay, I am currently in school, so again I use my nursing bag for school and for work. I bring my laptop even to work with me because sometimes if I can get a break, I go ahead and do some studying. If I have to do some quick notes on the paper, whatever I need to do, like for school, and I have this as well. I got this laptop from Walmart. It's an HP laptop. It was under $200, y'all. It was like 150 something. It was cheap. Again, if your girl bought it, it was cheap. Touchscreen, it's been doing real good for me, and it's been about 3 years, so I have that in there as well. So yeah, that is what I use in my nursing bag. Let me scoop my baby up here. My nursing bag for my day-to-day nursing. Again, everybody is a little bit different. Maybe you work in a hospital where you don't have to worry about whether or not you have vital supplies or the tools that you need to succeed. But look, I work in facilities. You gotta bring your BYOS, bring your own stuff, okay? So, there we go. Move that over. All right, guys. Thanks for watching my video. Let me know if you have any questions, any comments, anything you want me to bring to any more of the videos that I'm doing. I have a few more coming. School and work and being a parent kicks my butt. So that takes away from the time that I try to make the videos. But anytime that I can, I definitely try to make videos for you guys, because I know when I was in nursing school, or even wanted to see if I wanted to pursue nursing, these videos were very helpful for me to see. So you guys, like, comment, subscribe. Let me know what you want to see. Stay blessed. Have a good one.